Hello, everyone. Thank you for joining us for yet another session of Facebook Live Chat with an Expert. We will be hosting these sessions every Tuesday for the month of June to discuss some of the common concerns caregivers are experiencing during this pandemic. My name is Padma, and I'm a learning specialist with the Alzheimer Society of Calgary. Today, I'm very pleased to introduce you all to Dr. Alicia Cieslak, Clinical Assistant Professor of Neurology with the University of Calgary. Dr. Cieslak joined the University of Calgary Neurosciences Department as a fellow in the Cognitive Neurosciences program in 2015, after completing her medical degree at the University of Alberta and a residency in neurology at the University of British Columbia. Her research interests included reviewing therapeutic strategies for vascular cognitive impairment, as well as contributing to the understanding of mild behavioral impairment as a prodromal syndrome of neurodegenerative diseases that affect cognition and behavior. Dr. Cieslak joined the Cognitive Neurosciences Clinic in June 2017 after completion of her fellowship. Later that year, she also joined the Movement Disorders Clinic, where she follows patients with Parkinson's disease and has applied her training in cognitive neurology to assess cognitive changes in patients with advanced Parkinson's disease and Parkinson's plus diseases. She also sees patients in the general and urgent neurology clinics. And today she is actually at her clinic and has given up her lunch break to be with us. So we appreciate that. We are planning to spend about 20 to 30 minutes on the topic of repetitive behaviors and other behavior changes in persons living with dementia. At this time, I invite you to ask questions for Dr. Cieslak in the comment section of this video. Considering the public nature of the Facebook platform, we request you to avoid personal questions and try to keep your questions general. I would also like to remind you that this session is not to be considered as a substitute for a medical consult. So with that introduction, I would like to go ahead with the chat. So first of all, welcome to this chat, Dr. Cieslak.
Hello, thank you. Thank you very much for inviting me. I'm very happy to be here today.
Thank you. We are very happy to have you here as well. So I will start with a question about repetitive behaviors in persons living with dementia. In your opinion, what could be contributing to these repetitive behaviors? For example, a person is asking the same question again and again and again, asking for a family member again and again, or trying to do the same action again and again. And also, what are the strategies that caregivers could adopt in these situations?
Mm-hmm. Well, I think probably a large component of it would be related to their cognition and particularly their memory loss. So I think that's, I guess, an obvious point that obviously if somebody is repetitively asking the same question or repeating the same task, they may have just forgotten what's happened a couple of minutes ago or what's been said. Another component, depending on, of course, the degree of impairment with respect to the cognition, if language is or the ability to speak, understand, communicate is affected, it might be that they're trying to communicate a point and they're not understanding your answer, or they're not able to frame the question in a way that they feel is being heard. So they might just be trying to communicate with you, basically, and not reaching an endpoint where they're satisfied with the communications actually occurred. And I think, and there's also, as people do have impaired communication memory, there's a heightened sense of emotion. So sometimes repetition can be the result of sensing that something is wrong, or being confused, or being frustrated on a point, and trying to communicate that in a way through repetition.
And maybe even anxiety could be contributing to that, right? If they're anxious about something.
Absolutely, yeah. We know that. So you mentioned that my interest in mild behavioral impairment. So that's a degree of, say, psychiatric involvement of the disease early on in the course. But we know for sure that with Alzheimer's disease and other dementias, there's certainly psychiatric symptoms, and mood, anxiety are definitely predominant among those. And so for sure, if you are, as anyone is probably at some point in their life experienced anxiety or stress, you tend to focus on a certain point. And so absolutely, I agree, anxiety could be a part of it.
Yeah, and maybe doing the same familiar task again and again might be giving them a sense of comfort, maybe some kind of a soothing behavior.
Yes.
Do you consider it that way?
Yes, I think so. For sure, if it's something that I guess depending on what the task is, it might be something that is helping them calm. I think it would be important for the caregiver to observe whether or not whatever they were doing was helping them feel more calm or was increasing their frustration, right? Because not meeting a goal could also lead to a sense of greater frustration. So if you made the observation of which way it was going, it might be important to let them do this repetitively because it seems to be helping things, versus let's try to divert their attention to something else to try to reduce the frustration because they're not able to complete a certain task because their skill set in that task and their problem solving ability has been affected, right? And so now they're just getting frustrated.
So maybe it's you suggest that from what you're saying, what I understand is that maybe the caregiver can look for signs of frustration and anxiety, and then make a decision whether to distract the person, divert them to something else, redirect them to something else, or if it is helping them calm down, maybe just allowing them to do that, right? It's kind of a judgment that the caregiver makes based on their observations of what is happening to the person.
Yeah, absolutely. Because I think there can be multiple scenarios, multiple reasons, as we've talked about, for why they're doing that, saying that repetitive thing or doing that repetitive behavior. So I think the context is very important, and the caregiver is usually the person that knows that individual the most, so they can they have that ability to observe for details around whether what may be causing it, or what may be, whether it might be getting better or worse.
And I think another thing that would be helpful for caregivers would be to have a set of alternatives, a set of strategies, activities that they can keep available handy, so that if the person is getting frustrated and then they want to move the person onto something else, so they are not struggling at that point of time, have some backup plans ready so that they can, if the person is getting frustrated or the anxiety is increasing, then maybe distract them to something else that is more comforting, more relaxing for them.
Yeah, absolutely. Yeah, I think that's a great idea. And I think even among that group of activities that you may have for that person, I think it may change over time, and it will likely change over time what's soothing and what's frustrating. So kind of being open to an idea of observing if on, one day this is actually no longer effective, reconsidering replacing it is also important, because we know, unfortunately, this is an evolving disease that does get worse over time.
Yeah, that's a very good point, because sometimes the person might have enjoyed it before, but right now, as the disease is progressing because of their impairments, they are finding it, I've heard that from caregivers talk about how the person initially used to enjoy playing a game, in a particular game, something like golfing or things like that, but now it's becoming more frustrating because they cannot remember the rules of the game, and they know that that's not the way it's done. So it's not giving them the same kind of satisfaction as they would have got from it before. Right. So another question that I would like to ask you is, what about some compulsive ritualistic behaviors. Sometimes persons with dementia can do that, taking everything from the drawer that they have already organized, taking out everything, putting them back in, doing that again and again, repeatedly again, like a compulsive, as if they are compelled to do that, like a compulsive behavior.
So yeah, and I guess that might be tied to a different impairment rather than just memory loss. Like you point out, it might be more related to like a compulsive need, which I guess might be a little bit more difficult to tackle with respect to just creating just distraction to different tasks. So I think again, observing that is there harm related to this? Is it affecting their ability to I guess function in a way, right? Like if is it consuming their time and their lives and harmful in that way? And I think if it's something that you can't redirect from, like we can't say, okay, now it's time for your meal or your shower, whatever, right? In that case, or if it's somehow causing harm to the person, I think that's the point at which I think it would be time to discuss with their physician about strategies or maybe even medications to help with that particular behavior. Is I think it's a little bit more difficult to approach with behavioral strategies from the caregiver. I think more professional involvement would be required at that time. So it's really recognizing, is it related, to an actual compulsion, and how much harm is it causing?
So if there is no harm and the person seems to be enjoying what they are doing, actually the caregiver can take a break there and take some time off, but and do something on their own, because the person is not getting into any harm, and
absolutely
the person seems to be enjoying what they are doing. So even though they have done it several times over and over again, if that's what they like, you can just allow them to do that, right?
Yes, I agree. I think, in itself, it's not harmful, right? Like for somebody to repeat the same thing over. It's just, all I'm saying is if it starts disrupting other parts of life in itself, any repetitive task isn't going to cause harm.
Okay. Yeah, that makes sense. Thank you very much. Another question that we have been getting from caregivers is about the person getting, maybe they recognize as a sign of anxiety during this pandemic. The people family members who used to visit with them are not visiting anymore. Those kind of things. Extended family members are not able to visit with them. So maybe because of that, or not able to go to the day programs and things like that, the person constantly pacing about, not stopping, continuously pacing up and down and up and down. So what can be done at that point of time?
So you're saying that they're becoming more restless because there's less activity and
that's right.
less interaction, and they don't really understand why. There's some frustration that comes with that. So I mean, I guess this is a very challenging time for people with dementia and Alzheimer's disease, particularly because these are the social distancing and COVID related rules that we have are difficult enough to follow for those of us who are able to remember and understand what's happening. I think it's taking the time to explain and still repeat the explanation is important. I think it is important for people to know that this is a different time, that there are certain rules that have changed. And I guess being creative in how you can keep that person occupied. So I mean, now we do a lot of meetings virtually, so trying to meet with family members virtually and setting up meetings that way, going out for walks if they feel safe to do so. I guess activities around the home that your society I'm sure provides many examples of creative activities you could do at home. So really just occupying that person and continuing to explain, I think is important. And making sure, I think, as a caregiver, that you feel supported through this time. So taking time to yourself to talk to, even if you are also in isolation with the person who has dementia, making sure that you have separate times to speak with people that you feel supported by, because that will help you be successful as well.
Yeah, and to have that, to find some time for oneself. To be yourself and to just relax and wind down. That is very important for caregivers as part of self-care. We always say that self-care is not selfish. It is absolutely essential if the caregiver has to remain healthy for the person who needs care, right? So having that, dedicating that time for oneself is so very important. So whatever it takes, maybe going for a shower, or maybe just hiding in the bathroom. Maybe sometimes there's a caregiver, I've heard social workers saying that, maybe just take a washroom break. Nobody can come and disturb you there.
Well, I think I totally agree. It's so essential to be able to take care of, in order to take care of others, to take care of yourself. Because especially, I think, with the heightened sense of emotion that people with dementia have, they will read off of people who are not calm and anxious. So, and that will just make things worse for yourself and for them. And I mean, I think if you can identify a task that, even if it is something like a repetitive task, like emptying out and clearing out a drawer, if there's something that they can be occupied with for 20, 30 minutes, that gives you a break to talk to someone or lie down or whatever you need to do, and you feel they're safe in that time. I agree, that is really important to
listen to your favorite music, or watch your favorite show, something like that, and giving them, even getting the person involved in a household task like folding the laundry, or things like that. That maybe it's not perfect, the person may not be doing it perfectly, you might have to redo it. It gives them even the person a sense of being useful, right? I'm doing something for the family, I'm helping. So even though it is not the very perfect of task that they're doing, but still it gives the person a sense of accomplishment, and also gives the caregiver some respite time, a break, to let them do something.
I agree. No, that's a great point.
Great. Another question again we got was that about the person with dementia is living at home and is cared for by the caregiver at home, but over a period of time the person is not able to recognize the spouse who is a caregiver, and keeps asking, who are you, why are you here, and the spouse, the caregiver, actually feels a little bit insecure being in the house where the other person is not recognizing them. And they have tried things like showing the wedding pictures and saying that, okay, it's just me, I'm the same person, but I've just become old. I'm the same person, and it's just that I'm old. But it's not actually working. So what would you suggest?
Yeah, that's a very difficult thing to deal with, because there's emotion on part of the caregiver, right? There's a sadness that comes with that, absolutely. And also, like you say, a fear if the person that you love thinks you're an intruder or something like that. Right? So I think a key thing is safety, right? So making sure that even if they don't recognize you, they recognize you as somebody familiar, that they trust and they feel comfortable being around. If they seem scared or agitated, and they might say to you that they're worried that you're an intruder, well, this is a very important safety point where you reach out for help in that case. In the case that it sounds that they recognize you as somebody familiar, but not maybe their spouse or who you actually are, I guess, to them. That's I think I mean, another question is around whether it's happening all the time, or if it's happening maybe in the evenings or a certain part of the day. And it certainly reflects progression of the disease as well, right? So it might be getting to be a difficult time to be the main caregiver. I think even even just going along with what they feel is happening, as long as it's not a safety concern.
Yeah.
I'm saying, your spouse will return. I'm here to take care of you, remaining calm and reassuring them. I think that's the most you can do. I think spending time trying to convince them otherwise, I'm not sure that will be effective. I mean, you can try, but I think just accepting that, their brain has changed to the degree where they may not recognize you as specifically the person that you are anymore.
That's a very sad situation for the caregiver. There's a lot of emotions involved there. And it takes time to come to that level of acceptance. So we hear from caregivers, they're trying hard to kind of convince, and we tell them, okay, the same thing as you said, you can try, but if it comes to a stage where the person sees you as an imposter, not a safe person to be around, then it is a matter of safety, as you said. So what could the caregiver do in such a situation? Say the person with dementia is threatening to kick them out of the house, or threatening to hurt them. What can someone do in that situation?
Well, if it's that serious where they feel physically threatened, then they should leave the house immediately and call emergency services. Unfortunately, because if the person thinks that you're an intruder, and they may respond in a aggressive way. So that's a very serious point. I think it's also important to recognize it happening, because it doesn't happen overnight typically. So typically people start to not recognize more distant family members, than maybe children, etc. And if it's getting to that point, maybe to increase safety, removing anything that could be used as a weapon, particularly if you have guns at home or something like that, would be an important part. But your question about if they feel immediately threatened, that has to be immediately addressed.
Yeah. And trust their gut feelings about it, right? If you feel that it's unsafe for you, then leave and then call 911 would be the best option.
Yes, okay. Absolutely.
Okay. Yeah, we did hear something like that from a caregiver just last week, and that's what we advised. But fortunately, there was a daughter whom the person recognized, but did not recognize the spouse, but recognized the daughter. Okay. So there was someone to care for that person, so that this person could get out of the house, could leave. But again, where would one go? That's another question too. So there's lots of other.
And I think it's important to remember that when you do call, you can say, I know this person is not usually aggressive, but they have dementia, they have Alzheimer's disease. That's why they're acting. So sometimes I think there might be some guilt related to calling, 911 on somebody they love, right? So, and you're right. Where do they go? It gets very complicated after that. It's lucky for that individual that there was another family member.
It's true. Otherwise, even leaving the house, they are worried about what happens to this person. Would they hurt themselves? So there's all those concerns that caregivers are dealing with. Yeah. So thank you very much. It'll be reassuring for them to know that they can call, and there's no harm in doing that. But just tell them in advance what the scenario is, that this person is not like that. It's just because of their dementia and maybe some progression that is happening, that they are seeing this change. That could be that might put their minds at ease. Another question I wanted to ask you was about the person repeatedly calling out for help. And I've heard this from even care facilities, from staff who are working there. And I've read somewhere that it could be associated with frailty. The more frail someone is, the more they could keep on calling for help. But what can a caregiver do in that situation? And is anything you can suggest?
Yeah, that's a very difficult one for sure. I think, stepping back to thinking about repetitive behaviors and what's at the source of them. Is it memory? Is it that they don't know where they are and they don't recognize anybody and that's why they're frightened? And can you address from that point of view, make the environment more familiar for them, have, objects, pictures that are more familiar to help them reassure? Is it a compulsion? Is it something else happening? And that's sort of a phrase that they have in their mind. And the one thing, as I said, language is impaired. So sometimes people do kind of have a phrase that they say a lot, right? No matter what's happening. So then getting back to the source, are they uncomfortable? Are they hungry? Are they cold? Is this just, is this just a cry for, something's happening with me and please help me. So trying to see if there's a simple thing that you can try to address to try to provide comfort to that person. Are they doing something that is frustrating them, and they can't reach a goal? So I guess kind of is there, and then in their finding, is there more anxiety or more, is it more related to like a biological change where maybe we need to address the issue with medication? So identifying those first things and then going on to that.
Could pain be a contributor? If they are
absolutely,
right?
absolutely.
And sometimes we might have to look at or look for non-verbal signs of pain, right? If the person is not able to express that it's hurting them, then it will be just from their body gestures and how they are holding up, how they are positioning themselves, and the facial expressions. We might have to conclude or infer that this person might be in pain. Right?
Absolutely. And even a discomfort, like say there's somebody who's less mobile now, right? So even just shifting their position or shifting where they are in the room or putting them in bed for a little bit, something like that might even be helpful. It might just be that their back's a bit sore because they're sitting for the last hour or something like that.
And I'm glad that you pointed out the needs. The person needs, the person hungry. You mentioned that. Is there any physical need that is not met? Maybe that could be the trigger, or maybe even missing someone or feeling afraid. That could also be a reason for that, or having someone to sit beside them and comfort them. That all, and especially in these COVID times, visitors are not allowed, and these situations are happening more. In care facilities, even the staff in care facilities have mentioned that this is happening. They've gone to the person, make sure they are all, everything is taken care of. But again, we are human, so we tend to miss certain things. So I think it takes, you need to spend the time to actually figure out what is the underlying reason for this behavior. What is causing this person to call out like that? Is there anything that maybe from the environment, from health wise, from from any unmet need, those kind of things? I think those are things to really to put some serious thought into that. And before they think of medicating someone or dismissing it off as a sign of progression of dementia, right?
Yes, absolutely. Yeah.
And we are hearing that from care homes this time, from caregivers who are saying that their person was not on any meds for behaviors at all, but now that they have not been able to visit, and there's been pressure from the care facilities to medicate the person because of all these behaviors. And even today there was a call from someone whose mom is in a care home, and he has called me before about starting some medications and his concerns around that. And today, I'm not a social worker, so I'm not actually in that, that's not my role, but still, because he has talked to me before, he tried to reach out to me again today to talk about some concerns about new medications, antipsychotics that have been, the home is trying to prescribe and insisting that your mom has to be on that. And that can be very difficult for caregivers to make that decision.
Oh, yes.
Yeah.
It's a very challenging time. For that specifically. And
also there is, for some other things you might say that there's an end, there's a light at the end of the tunnel. But for this kind of situation, nobody knows. It's been From March, it began in March, and initially our caregivers, when we used to do wellness check calls, they were doing fine. They were managing, they were okay, they were very optimistic. But over a period of time, over these 3-4 months, we are seeing a decline. We are seeing that they are more overwhelmed with what's happening, and with no end in sight. No definite end in sight, and this is very challenging for our caregivers now.
Yeah, just this uncertainty, right? Yeah. About what's going to happen if,
At the same time, it is, we always say it's important to have that optimism and try to stay positive, and just think that you're doing your best. You cannot, maybe you're not doing the very best that can be the ideal that can be done for the person at this time, because the caregiver is away, not able to visit with the family member anymore. But in your circumstance, you are doing whatever you can.
Are they allowing virtual meetings? Is that something that?
Yeah, that also depending on the time that is available. And for some persons, it is, it's almost like they're not recognizing, they're thinking it's like a picture, it's a photo. If they don't have any previous experience of using technology before, they're just as if watching television. They're just looking at the person, and they're not even
making the connection.
Yeah, they're making it's a real person there.
What about recording at least the caregiver's voice and recording like a song or story or just a discussion?
Yeah. That's a very good idea. We have suggested that. Yeah.
Okay.
Yeah, we have suggested that because that could be helpful.
Yeah, and that's something then the caregiver might feel like they've contributed, they're helping, they're there for their loved one, and it's something at the the facility or the nursing home they might be able just to present at the time to see if it at least works as a initial step, right? Yeah.
Very good idea, because we did suggest that for especially for personal care activities, during that time, if the person is getting too agitated, then having a video taken by the family could take a video and say that, Dad, so and so will be coming to give you a bath, and she's a very good person, so do not be afraid, and once you have had your chat, when I will call you and we can meet, something like that, something to get the person to comply with those with those personal care tasks. It's difficult for even the staff, for both the staff as well as the family caregiver at home. These are very tough situations. And fortunately, we have technology. If we did not have that, what could we have done? Right? So at least maybe taking comfort in that, we can use some technology, maybe FaceTime or videos or Zoom sessions, something like that. Great. Another question I want to ask. Let me just check if someone has added any question here. I didn't see anything last time. So just looking at. Let's change the page. Okay. So in the meantime, I would like to ask you about wandering. So that's another thing that we are hearing. The person trying to leave. Trying to get out. Again, what are some strategies for families at this time?
So that's a tough one. Questions are getting tougher.
Sorry about that.
Yes, I mean, I think if it helps the person feel more calm, and if it's safe to leave the home, and if the person is willing to, be accompanied, I think, having, using the time to get some physical activity and go on a walk is a good idea, especially now. Luckily, the weather, aside from the thunderstorms, the weather has gotten a bit better. And then if it isn't a situation where you could turn it into, a walk or experience together, trying again distractibility or distraction and steering toward a different task. I guess the concern is about the person leaving on their own and you being unaware, right? If they've wandered off. So in that case, that's more of a safety concern. So I think if you're in, if you're in a neighborhood where you've been there for a while and you know some of the neighbors, sort of, if you feel comfortable speaking with your neighbors about also keeping an eye out, and if your loved ones left, and there are devices that you probably know more about than I do, but watches and
shoes, shoes with the soles and all those kind of things. So that's, and also registering with the medical alert safely home registry, so that even if the person gets lost, they can be reunited with the family and things like that. Do you think strategies such as say putting away the person's shoes and their coat and things like that out of sight would discourage them from leaving the house? Would that be helpful?
It might be, yes, as a would avoid triggering that idea. Absolutely. So just closing the front closet door with their shoes and jacket tucked away. It might be that. No.
And we even suggest disguising the door. If there's only one main door out, disguising it, having some pictures or something like that. So at one glance, the person may not be able to recognize it as a door, like they do in care homes. I've seen they do that, like a sham bookshelf or some kind of big mural, something like that, a life-size picture portrait of someone. So it is, others know it's a door, but for the person may not recognize that as a door. So something could be tried. These are things could be tried.
Yeah, absolutely. That sounds like a good idea.
I think it needs a lot of creativity, right? Understanding, creativity, and patience to come up with these. And when someone is, if you're nervous and anxious, then our brain doesn't think well at that time. It's I think possibly maybe thinking about this kind of possibility earlier would give a caregiver some time to plan some strategies, to talk to the neighbors, then in the neighborhood, if you do see this person, to bring them back home, and also some photos of that person, things like that. And I've heard even a caregiver say that she always takes, each day after the person is dressed, she takes a photo of that person. Just in case, if the person walks out, there's that, what are they wearing today?
Oh, yes. Okay.
So it's almost like, oh, you look great today. Let me take a photo, So every day taking a photo of that person and what they're wearing, so that if in case, if such a situation happens, they still have the most current photo of that person in what they're wearing. So
it's always interesting to talk to caregivers to see what strategies they've come up with, right?
That is true.
Every situation is unique, and people think of some good ideas.
So for the caregivers, who are not dealing with this wandering behavior kind of the challenge at this point of time, but I think this conversation would encourage you to keep that possibility in your mind and kind of come up with some strategies and a plan that you could use when that happens. So hopefully I feel this session has been very beneficial for everyone. So I think we are almost nearing the time, and we are, you need to get some time for your lunch before you head back to your clinic, Dr. Cieslak. So I think this is a right opportunity to conclude the session now. So first of all, a big thank you to Dr. Cieslak for joining us today. And as I said, you have given up your lunch break for us, and we really, really appreciate that. So there is a very big thank you from all of us at the Alzheimer's Society of Calgary. It has indeed been a great pleasure to chat with you today. And for all those of you who joined us today for this Facebook chat, thank you very much for joining us. Please join us next Tuesday for a chat with Dr. Sarah Goodarzi on the topic of behavior changes in persons living with dementia. And we'll be focusing on behaviors such as hoarding, rummaging, and so on. And that chat will be in the morning at 10:30. In the meantime, please feel free to call us at 403-290-0110 to speak to a social worker one-on-one, or send us an email at info@alzheimercalgary.ca. I take this opportunity to encourage you to like and share this video and follow the Alzheimer's Society of Calgary Facebook page for more videos in the future. So until then, until the next session, take care, and please give us a call or reach out to us if you need any more assistance in any way. Thank you very much. Have a great afternoon.
Thank you.
So thank you very much. We are concluding the session now, and
Okay.
I'll get back to you. Okay.
Thank
So enjoy your lunch break. It's been a great pleasure chatting with you.
It's very nice to meet
Bye-bye.
you. So thank
Have
you.
a great afternoon. Bye-bye.